Hey everyone, my name is Preston Freeman. I'm a nursing student at Southeastern Louisiana University, and today I am going to be talking about organizational culture in the workplace and its impacts on nursing. This is for my Management of Health Services organization class. So, what is organizational culture? It is a fundamental aspect of any organization and refers to the shared values, beliefs, norms, and behaviors that shape how individuals interact, make decisions, and approach their work. It serves as the underlying framework that influences communication styles, leadership approaches, and overall workplace dynamics. A strong organizational culture helps foster trust, collaboration, accountability, and a sense of purpose amongst the employees. This can lead to higher engagement, improved performance, and a greater organizational effectiveness. It plays a critical role in guiding how an organization responds to challenges, adapts to change, and pursues its goals. Organizational culture is closely connected to an organization's mission, vision, and values, and helps translate these guiding principles into everyday actions and expectations. Leaders are key drivers of culture as their behaviors, decisions, and communication styles set the tone for the organization and influence how employees perceive and embody its values. Over time, organizational culture becomes deeply embedded and can significantly impact long term success, adaptability, and sustainability within the workplace. Ultimately, a well defined and supportive culture creates an environment where individuals and teams can thrive while working toward shared goals. So, we've talked about organizational culture in a general work sense, but what are its impacts on nursing? Well, nursing is the largest occupational group in the healthcare sector, and this equates to significant influence on the organizational and workplace culture. Nurses have a large impact on the way a workplace environment operates. For nurse leaders and managers, culture influences leadership styles, communication, and how change is implemented. For staff nurses, culture affects retention, workplace bullying, absenteeism, and adherence to guidelines. A positive culture promotes collaboration, shared governance, and open communication. This allows leaders to effectively guide teams. Culture prioritizes teamwork and can reduce burnout and improve patient outcomes in a healthcare setting. So, in the sense of nurse leaders rather than staff nurses, these are our managers, our CNOs. What happens when they have a alignment with the organizational goal? So, an organizational alignment, what is the impact of that? Leaders who embrace organizational values are more effective in motivating staff and driving the organizational outcomes. This leads to consistency, authenticity, and trust of that leader. Leaders who embrace organizational goals promote patient centered care, integrity, and excellence. Alignment with organizational goals ensure that decisions made by leaders support a broader organizational goal. So, what does that mean? That means increasing the quality of care, decreasing cost, and enhancing patient satisfaction. However, misalignment with organizational goals of the leader leads to conflict, decreased morale amongst nurses, and ineffective leadership. We really need leaders who believe and thoughts align with organizational goals to help promote a healthier work environment. So, what is the impact that a nurse leader has on meeting these organizational goals? Well, nurse leaders, they model expected behaviors and set the tone for for the work environment. This could be a toxic work environment or a productive work environment. Nurse managers operationalize policies, they model transparency, and reinforce accountability. This helps close the gaps that could align into system failure. Effective nurse leaders help translate the organization's vision into daily clinical practice, making it meaningful and actionable for staff nurses. In promoting accountability, encouraging professional development, and supporting evidence based practice, nurse leaders have a huge impact on meeting organizational goals. They ensure that care aligns with ethical standards and, again, organizational goals. Well, what are some other impacts that organizational culture has on healthcare? Organizational and workplace culture directly impact the experience, satisfaction, and health outcomes of patients. Organizational culture shapes the success and sustainability of quality improvement initiatives. This could be things such as like new technologies, adopting evidence-based protocols, or improving care delivery methods. Overall, these quality improvement initiatives are meant to decrease the cost and errors in medical practice. So, an example could be adherence to best practices in infection prevention or early mobility protocols. These are put forth for patients, and having leaders and a healthy organizational culture or workplace culture helps foster adoption of these new delivery methods. Lastly, and I think this is a huge part of organizational culture and workplace culture, limitations and utilization of resources. Limitations are going to be nurses and individuals knowing what they're capable of. So, recognizing personal but also team limitations as a critical component of safe, effective nursing practice and strong leadership. Nurses who are self aware are more likely to seek clarification, ask for help, and engage in continuous learning, all of which are essential for maintaining competence and delivering high quality care. Leveraging resources, so again, utilization of resources helps bridge knowledge gaps and helps enhance decision making. An example of utilization of resources would be consulting a pharmacist for medication compatibility or using institutional protocols for sepsis management. An example of limitations, especially in the sense of the leader, would be a charge nurse who identifies a new grad nurse is overwhelmed and helping distribute responsibilities amongst some more seasoned staff, or even taking on some of those responsibilities themselves. Just identifying where help is needed. And this concludes my presentation on organizational culture. Again, not too lengthy, but just to kind of summarize, organizational culture is a foundational element that helps shape nursing practice and leadership effectiveness. When the organizational culture is positive, it is grounded in shared values, collaboration, and accountability that help support staff and promote high quality patient care. When organizational culture is aligned with the organization's mission, vision, and values, the nurse leaders play an important role in that. They help reinforce this culture by modeling professional behavior and supporting their teams. Additionally, practice innovations and strong role performance enhance the efficiency and improve outcomes and contribute to continuous organizational growth. When nurses or nurse managers recognize personal and team limitations and utilize resources, this helps further strengthen their clinical decision making and helps with patient safety. Ultimately, when a culture, leadership, and innovation are aligned, healthcare organizations are better positioned to achieve excellence, help improve patient outcomes, and sustain long term success. Thank you for listening, and I hope I helped give a summary of the big impact that organizational culture has in nursing and in the healthcare field.